Welcome to another episode of Med Madness, where we break down complex medical topics into easily digestible insights. Today, we're delving into maternal serum α-Fetoprotein screening, commonly known as MSAFP. This screening plays a pivotal role in prenatal care, helping to identify potential fetal abnormalities early in pregnancy. Let's explore what MSAFP is, why it's important, and what elevated or decreased levels can indicate. Alpha-Fetoprotein, or AFP, is a protein produced mainly by the fetal liver and gastrointestinal tract. During pregnancy, AFP is present in fetal serum and amniotic fluid. Eventually, it gets absorbed into the maternal circulation, which allows us to measure it through a maternal blood test known as Maternal Serum α-Fetoprotein, or MSAFP. This test is part of a broader screening called the Quadruple marker test. This test also includes unconjugated estriol, BHCG, and inhibin A, providing a comprehensive tool for screening fetal aneuploidy and congenital defects. Next, let's discuss one of the significant findings we look for with MSAFP screening, which is elevated AFP levels. There are a few common reasons why AFP levels might be elevated. For instance, in multiple gestation pregnancies, the greater volume of fetal tissue produces more AFP. Similarly, inaccurate pregnancy dating can also lead to elevated AFP levels because AFP fluctuates with gestational age. However, in singleton pregnancies, where the dating is reasonably accurate, elevated MSAFP levels can be a strong indicator of congenital defects. In such cases, the associated fetal anomalies often include abdominal wall defects like gastroschisis and omphalocele, and open neural tube defects such as anencephaly and myelomeningocele. These defects cause more AFP to leak into the amniotic fluid, thereby increasing the levels detectable in maternal serum. To further evaluate elevated MSAFP levels, an ultrasound is typically conducted. This helps to assess fetal anatomy in detail and confirm the pregnancy dating, ensuring that the elevated levels are not due to inaccurate gestational age. On the flip side, decreased MSAFP levels are also clinically significant. Lower than normal AFP levels are often associated with certain aneuploidies such as trisomy 18 and trisomy 21. These conditions can significantly impact fetal development, making early detection through MSAFP screening and other markers critical for managing the pregnancy appropriately. To illustrate this, let's consider a real-life case study. A 28-year-old pregnant woman comes in for her routine prenatal checkup. She's 18 weeks along, and her fundal height measurements are consistent with this gestation period. Her last menstrual period also supports this dating. During her visit, she undergoes the quadruple marker test, and her MSAFP levels come back elevated. Given the accurate dating and singleton pregnancy, her healthcare provider suspects a possible congenital defect. An ultrasound is performed which reveals an open neural tube defect, specifically myelomeningocele. With this information, the healthcare team can now plan the necessary interventions and provide the family with detailed counselling about what to expect moving forward. This case highlights the importance of MSAFP screening in prenatal care. Early detection of potential issues allows for timely interventions, better preparation, and improved outcomes for both the mother and the baby. By understanding the causes of elevated and decreased MSAFP levels, healthcare providers can better manage pregnancies and ensure optimal care. That wraps up today's episode on maternal serum α-Fetoprotein screening. We hope you found this discussion insightful and informative. If you have any questions or topics you'd like us to cover in future episodes, feel free to reach out to us. Until next time, stay curious and stay healthy. Thank you for listening to Med Madness. Don't forget to subscribe and leave a comment on what you found most interesting about today's episode. See you next time.